Cowie is also on. Great, thank you. Yes, I can see that as well. Okay.
Yep. Hello there.
Hi, Professor Afif.
Gracefully.
Oh, yes.
Gracefully.
It's the alternative.
Yeah.
Grace.
Minister Spence, if it's okay with you and also with you, the Honourable Steve Bracks will start, and I'm sure the Honourable Marlene Carouse will join us very soon. So good evening, and thank you very much for joining this important event. I'd like to start by acknowledging the traditional owners of the lands on which we are gathered to have this meeting tonight, and pay my respect to the elders past and present, and and pay my respects as well to all of the dignitaries, the members of Parliament, and all of the faith leaders, and each and every one of you for joining us tonight. This event is a result of the leadership and collaboration across the Lebanese community and coordinated by the Islamic Museum of Australia and the Australian New Zealand Lebanese Chamber of Commerce and Industry. And I hand over to Fadi to say a few words, followed by Mustafa. Thank you, Fadi.
Thank you, Vivian. We acknowledge the traditional custodians of the land we stand upon and the Wurundjeri people and their forebearers, past, present, and emerging. I want to thank the VMC and its dynamic, hard-working commissioner, Ms. Vivian Nguyen AM. I thank her on behalf of our community for putting together such an important forum in protecting our community from the spread of the virus. I'm sincerely thankful to the Victorian government and the Department of Health Services for their ongoing support to all Victorians in managing an elusive virus that has cost lives and severe economic costs on the government and the private sector. I wish to acknowledge all the guests and speakers and participants in this forum this evening. Thank you for your care and support. To our community, I plead to you today that COVID-19 is not a fallacy, not a conspiracy, or a political gig. COVID-19 is a real pandemic that is indiscriminate in its spread. It has no regard to religion, gender, age, color, or greed. We are all vulnerable to this virus. This virus has caused significant loss and at best left many suffering from its unbearable symptoms. As you are all aware, the virus has impacted our economy and our normal way of life. The government and health authorities can do so much, and without your support, this virus will not be contained or controlled. The government and the DHS has contributed significantly in providing testing centers and free vaccines and access to information and financial support to those who suffered from its consequences. It's now our responsibility to protect our loved ones and our economy by first adhering to all the rules and regulations issued by the government for our benefits. Secondly, to get tested. And thirdly, to get vaccinated if you have not done so. Regretfully, it is a fact that our community today is experiencing high cases and some fatalities. If you have any concerns or questions in relation to either being vaccinated or any general questions in relation to COVID-19, we have tonight representatives from DHS who will be able to address your concerns. Finally, be careful of the integrity of false social media and its baseless assertions that are misleading and damaging. Once again, I say thanks to all of you, and I hope you make use of tonight's forum. Thanks, Viv.
Mustafa.
Thank you, Brother Fadi and Vivian. Firstly, Assalamu alaikum and peace be unto you all. I also would like to acknowledge the traditional landowners that we congregate on from the different areas that we've all dialed in, and pay my respect to the elders past and present. On behalf of the Islamic Museum of Australia and my family, I'd like to thank you all tonight, our distinguished speakers, ministers, Fadi for working so quickly with myself and the VMC, the Victorian Multicultural Commission, and the general Lebanese community as a whole. The VMC, the Department of Health, all your support, resources and efforts has truly been amazing. It shows the strength of our community, that no matter faith or race, we can all unite for a greater good. This is the strength of us as Victorians and us as Lebanese Australians, the beauty of a social, cohesive and multicultural state and country that we live in, that we can all congregate so quickly. As Ferdi mentioned, our message is very simple for our community. We urge all our brothers and sisters to continue to come forward and be tested as soon as you feel any symptoms. This will help stop the spread of COVID and keep ourselves and our loved ones and our community safe. The problem with it is that as soon as we do, or anyone does receive it, the first people we harm is our immediate loved ones, because we enter our household. And from there, it gets passed on and it grows. As Ferdi mentioned, this is no joke. This is no conspiracy. And unfortunately, our community has been hit hard with it. And now we see that it's real and how it's impacted their lives. So firstly, I wish everyone that's been impacted by it a speedy recovery, a safe recovery. And I thank everyone that's here tonight for you to make most of this session and ask the questions you need to ask. So thank you very much for all dialing in, and Viv, I'll pass it back on to you.
Thank you, Mustafa and Fadi. I'd like to acknowledge our distinguished guests in attendance tonight, the Honourable Ross Spence, Minister for Multicultural Affairs, the Honourable Steve Bracks, AC, former Premier of Victoria, Chancellor of Victoria University, the Honourable Melissa Horn, Minister and Member for Williamstown, the Honourable Marlene Carruth, Member for Cooroid, Mr. Caesar Mellum, State Member for the Western Metropolitan Region, Dr. Ziad Itani, Consul General of Lebanon in Victoria, Monsignor Joseph Takji, OAM, Our Lady of Lebanon Maronite Catholic Parish, Sheikh Ali Rabah, Preston Mosque, Professor Dr. Afif Haddad, Dr. Michael Karali, Chairperson of the Victorian Lebanese Community Council, Professor Ben Cowie from the Department of Health, and all other faith and community leaders in attendance today. This event is being recorded and also live streamed on the VMC Facebook. I'd like now to introduce the Honourable Ross Spence, Minister for Multicultural Affairs, to share a few words about the importance of community action. And following Minister Spence is a few words from Minister Horn, the Honourable Marlene Carruth and Caesar Mellum. Thank you, Minister Spence.
Thanks, Viv. And before I begin, can I also acknowledge the traditional owners of the various lands that we're all meeting on tonight, and pay my respects to elders past, present and emerging. And can I thank you all for joining us online tonight. I'd also like to thank Viv and the Lebanese community and faith leaders more broadly for organising and participating in this important forum. I'd also like to acknowledge the presence of my parliamentary colleagues and staunch advocates for the Lebanese community, Caesar Mellum, Melissa Horn and Marlene Carruth. This roundtable is a dedicated forum to provide the latest information and relevant services available, and it's an opportunity for you to raise concerns impacting your community directly with representatives from the Victorian Government. Your insights will help guide our government's actions to reach and support Victoria's Lebanese communities during the pandemic, and to help us understand the unique and evolving impacts of this virus. After successfully eliminating COVID-19 from our state previously on numerous occasions, I know that you all must be frustrated and exhausted by its return. We all share in that frustration and exhaustion with you. I want to acknowledge the challenges that you've experienced over the past 18 months and continue to as a result of the most recent outbreak and the highly infectious Delta variant. While restrictions across Melbourne are a necessary and important response to the increase in case numbers, we don't underestimate the impact that this has on communities. And I want to thank you for your willingness to provide really crucial support to your communities during these difficult and challenging times. And I say that acknowledging that for so many of you, these challenges are not just local. Having been confronted with the stresses of the pandemic in Victoria, whilst also being concerned about family and friends in other parts of the world that you would not have been able to visit and connect with in ways that you otherwise would have been able to. So my thoughts are with you in recognising these additional challenges, and my deepest gratitude is with you for doing this whilst continuing to support your community. My gratitude also extends to those of you who have already received and booked in for your COVID-19 vaccination. We need to encourage each and every person in Victoria to get vaccinated and to get tested at the first sign of symptoms relating to COVID-19. We're doing everything we can to slow the spread of this virus now that we acknowledge that COVID-0 is no longer attainable. And we're learning from previous strategies put in place, and we're partnering with community leaders like yourselves to identify actions and initiatives that are community-led and that will make a difference. The conversations that we've had so far have led to changes in the way that we create targeted health and safety messaging for multicultural communities. However, we know that there's always more that can be done. And that's why discussions like this are so important in ensuring that communities have got up-to-date and accurate information relating to outbreaks, to testing, to vaccinations, and to the supports that are available. So today I want to ask you to share messaging about getting vaccinated. I know that there may be concerns or hesitancy among some community members, and I hope that we can address these issues here tonight. Your openness is much appreciated and all questions are welcome. And I'm really pleased that Professor Ben Cowie is here to answer your questions. And I thank you, Professor Cowie, for your time tonight. We've been working really closely with multicultural communities to ensure that our vaccination program is culturally safe and accessible to our state's multi-faith and multicultural communities. And I encourage you, as I have every Victorian, if you haven't already been vaccinated, please book in as soon as possible or consult with your doctor or pharmacist to book in for your vaccination. Testing and vaccinations are free for everyone living in Victoria, including people without a Medicare card, such as visitors from overseas, international students, migrant workers and asylum seekers. I'm optimistic about what the future holds for all Victorians as we work towards higher vaccination rates, because higher vaccination rates are the path to reopening our state. I would like to take this opportunity to express my gratitude for your participation and the work that you're doing to keep your family, your friends, community and our state safe. Community leadership really is fundamental, and your insights today will help inform a path forward together and to emerge as a stronger Victoria. I've participated in many of these roundtables and I'm always really humbled and incredibly grateful by how generous participants are in their openness, their questions and their sharing of information, and I'm sure tonight will be no different. So thank you. Finally, I would like to conclude by acknowledging the really significant contributions made by Lebanese Victorians to the economic, social and cultural life of our state each and every day. I live in the Hume municipality, which is home to the largest Lebanese community, so you're very much a part of my life every day. Victoria's Lebanese communities are a really shining example of what makes our state great. The community is coming together to defeat this virus, and the proactive role that you're playing as community leaders without expecting anything in return is testament to why you're one of our most valued communities in Victoria. So with those words, I'll conclude and hand back to Viv, and I hope that you all get really great benefit from this forum tonight.
Thank you, Minister. We now have the Honourable Melissa Horn to say a few words, followed by Caesar Mellon. Thank you.
Thank you, Viv. And I too would like to acknowledge the traditional owners of the lands on which we meet and pay my respects to elders past, present and emerging. Can I also too share Roz's sentiment in thanking you all for coming out tonight and acknowledge my parliamentary colleagues and of course Steve Bracks. I'd just like to share with you, as the member for Williamstown, some information that's happening in my local community and your local community. As we know, Hobson's Bay has been one of the hotspots in this latest outbreak. And your support is absolutely vital to be able to get the word out about why vaccination is so important. Today I popped into the pop-up vaccination hub at the Australian Islamic Centre down in Newport that has been done in partnership with the Newport Mosque and also to Western Health. Now, that has been after weeks of advocacy with the Health Minister's Office and also with the Department of Health, knowing that this is something that we needed so vitally down in our community. And certainly when it had been announced and there was that online booking service available, it had been booked out within a matter of days. Speaking to the health service providers down there, and it was really encouraging to see that they had put a lot of thought and effort into making sure that this was a vaccination hub that would support our local community, particularly community that was very familiar with Newport Mosque and would feel very comfortable turning out there. There were culturally appropriate booths there so that women could be vaccinated by women and in an appropriate manner. There were translators available that could take people through detailed medical advice so that they could overcome any hesitancies that they may feel. And there was also medical information available for whoever turned up. One of the disturbing things, though, was talking to the head nurse there, was that people were, whilst the centre had been booked out, there were some people that were not showing for their vaccinations. So they'd made an appointment, but then had not been able to, for a variety of reasons, be able to turn up to their appointment. And the centre was working on how to manage that latent capacity that they had so that more people who did want to turn up could avail themselves of a vaccination. I think this is one of the really important things that you as leaders in your community can help us overcome, so that if people are doing the right thing, they then follow through and we make sure that those jabs in arms are occurring. So that's why tonight is so important. And I would like to thank each and every one of you for giving up your time to be able to turn out tonight so that we can spread the word throughout our community, because we know that vaccination is our way out of this. So thank you.
Thank you, the Honourable Melissa Horn. Over to you, Caesar.
Thank you, Vivian, for a great job, and I really appreciate coordinating this. And I also want to sort of join you in acknowledging the traditional owners of the land of which we all gather and pay my respect to elders past and present. I'm going to be brief, but I was just going to say this and echo some of the words. I urge everyone, don't listen to the conspiracy theorists. Just listen to your doctors. Vaccine is safe. AstraZeneca is safe. I've had my double dose of AstraZeneca and I'm doing well. I'm here talking to you. It's important that we listen to our doctors and important that we get the vaccine. And the best vaccine we can get is one we can get. There's going to be heaps of vaccine coming through to Victoria next week. More GP clinic will be online as of Monday, 3 weeks late, or we're getting there. So it's important that we do that. Also, it's important that our community leaders to start talking to everyone. If there's 103 people online tonight, if 103 talk to 10 people, and the 10 people talk to another 10 people, we're talking tens of thousands of people. We need to actually turn people to go and vaccinate themselves. It's important. That's our ticket to freedom. We've seen that around the world, and we can do it here. We open up regional Victoria today, and hopefully Melbourne not far behind. It's important that we be positive about it. Lucky we're living in the 21st century. Imagine we have that vaccine in 1918, where millions and millions and millions of people died, and we know a few millions already died in this pandemic. So it's important that we actually give everyone a positive message. The vaccine is safe, and that's the only way for us to live a normal life and save our loved one. And I'll say to the Lebanese community is just have to think back and remind our people, the Lebanese descendant here in Australia, what's happening in Lebanon right now, because they haven't got the resources we have in Australia. So we have no excuse. It's in our hand. We need to make sure everybody's out there vaccinating and testing. It's important we do that. And I want to finish off by thanking all the medical staff, all the health workers, emergency service workers that have done tremendous work, particularly in the Western Metro region, my region. They've done an amazing job. We need to help them out. And the only way we can help them out is by turning up to vaccinate, turning up to test. Because if we lose our medical staff, we actually be risking more people dying. So look, there's a light at the end of the tunnel. We're in the last quarter. If you follow football, it's always difficult. And I'll just take you back to my favourite team, the Western Bulldogs, when we played Brisbane. The last quarter was the hardest one, but they got through by determination and being positive. So thank you for everyone turning up tonight. Keep up the good work, and I want to acknowledge the Honourable Steve Bracks for joining us tonight. And that's, I think, a testament to the strength of the Lebanese community and how important that is. And Steve, thanks again, and Melissa and everyone. So keep up the good work. Let's spread the message. The only way to get out of this is get vaccinated.
Thank you, Caesar. Very timely. We now introduce the Honourable Steve Bracks AC, former Premier of Victoria and Chancellor of Victoria University, to share your message. Thank you very much, Honourable Steve Bracks.
Thank you very much, Viv, and thank you everyone for coming online for this community forum. Could I also acknowledge the traditional owners of the lands we are variously meeting on today? Could I pay my respects to their owners, past, present and emerging? Could I acknowledge also the Minister Ros Spence, Minister Melissa Horn, MPs Caesar Mellon and Melina Carews, and former MP Eddie Micallef, who I had the pleasure of serving with at a period in Parliament as well. The Lebanese community have always been community leaders in Victoria. From the early waves of migration, when my family came out here, my ancestors in the 1890s, to the 1920s when Jack Nasser's family and others came out here, to the post-Second World War period where we had a significant Lebanese migration, to the post-Civil War period in Lebanon where we had significant Lebanese migration. All those waves of migration have proved that the Lebanese communities have been important community leaders. What it means today to be an important community leader is to ensure that we get out of this pandemic. And the only way we're going to get out of this pandemic is if we have a significant amount of our population vaccinated. And that includes the Lebanese community. And so getting the message out that the vaccine is our only message, is our only way out to freedom, our only way to reunite with our families, our only way to travel again, to get back to Lebanon. I can't believe that it was only 2 years ago, Fadi Zuki, that we were together in Lebanon, having a meal there. I look to the time again when we can get back again, but it won't happen. It won't happen until we get our vaccination levels up. So really, it's our responsibility to make sure we get the message out. Book a vaccine. Get tested if you have any symptoms. Make sure we can get on top of this. Make sure that the Lebanese community is one of the leaders in ensuring that we have a good penetration of vaccines in the community. Just look at what's happening in Lebanon. Already we've had something like 3 million doses of vaccine into people's arms in Lebanon. They're voting with their feet. Let us do it too. and ensure that that we do what we've always done in taking a leadership position in Victoria and ensuring that that leadership means that we get the message out to get vaccinated and get vaccinated quickly.
Thank you, the Honourable Steve Bracks. I now invite our faith leaders, Sheikh Rabah and Monsignor Joseph Taki, OAM, to share your words. Sheikh Rabah.
Yes, Assalamu alaikum all, how are you? Alhamdulillah, all praises due to Allah and may His peace and blessing be upon the Prophet Muhammad sallallahu alaihi wasallam. It's a duty among us community and faith leaders to join hands and forces to fight this global pandemic called COVID-19. It's an Islamic duty that we all take the professional advice from our industry leaders, experts, and scholars in how we stay clear and ensure we protect ourselves, friends, and families. It's a religious obligation upon us, and Islamic advice we take are taught to us from our Lord Allah in His Holy Quran and His Prophet Muhammad, peace be upon him, Sunnah. So I urge our Lebanese community and others out there to follow the DHHS guidelines to stay home. And if exposed or being to exposure site or feel any symptoms, no matter how small, to urgently and immediately get tested to give the peace of mind for your parents, families, and community to be safe. And if you can and eligible to get vaccinated by protecting yourself and others. Because the Sunnah teach us that if a pandemic hits you, to stay home, not to travel or leave the place impacted, to keep a distance, not infect others. So at the end, please, my community, my brothers and sisters, stay home, stay safe. If you feel any symptoms or being close to an exposure site, please get tested, as the only ones we harm is our loved ones first and the rest of the state. Thank you all for listening to me and to give the time for remind our community for this pandemic. And I'll make a little dua at the now before I finish. بسم الله الرحمن الرحيم الحمد لله رب العالمين والحمد لله وصلى الله على نبينا محمد وآله وصحبه أجمعين. اللهم اهدنا فيمن هديت وعافنا فيمن عافيت وتولنا فيمن توليت وبارك لنا فيما أعطيت وقنا واصرف عنا شر ما قضيت فإنك تقضي بالحق ولا يقضى عليك. اللهم ارفع عنا كل داء وبلاء الخارج من الأرض والنازل من السماء واصرف عنا كيد الفجرة والظلمة والأعداء. اللهم اجعل هذا البلد آمنا مطمئنا سخاء رخاء وسائر البلاد يا رب العالمين. وآخر دعوانا الحمد لله رب العالمين. Thank you all. السلام عليكم.
Thank you, Rabbi. Thank you, Sheikh Rabah. Monsignor Joseph Taki, OAM.
Yes, thank you. It's acknowledge the traditional owners of the land and our distinguished guests. It's certainly, we need to look at the needs of our Lebanese community. Within our own community, it's been, this lockdown has proven to be the most difficult and more difficult than all of last year's lockdown because of the different problems people are encountering, mental issues and family issues, financial issues, relationship issues. And I know that we've been promoting the vaccinations. I know a lot of our elderly people have accepted vaccination very easily. It's more the younger, more English-speaking 40s or 50s who are questioning and who seek a lot of answers. We advocate, we promote vaccinations at all our live streams. We have live stream connections with our community. We have email connections. We have different ways that we can communicate. And the Holy Father, our Pope, has told us that the vaccination is an act of love and we should all get vaccinated. Our Patriarch has told us, our Bishop continually reminds us and sends us letters that encourages us to be active members in the community and responsible and responsive to government restrictions and guidelines. And we have to uphold the laws, uphold the rules and the regulations and the restrictions. And I want to encourage all our young people. I know that quite a number of our community have already been vaccinated. First jab, they've had the second jab, I've had both jabs. I know most of our community, the elderly, are taking this probably a lot more seriously, and they're not questioning as much as the more younger people who are on social media, who are reading all sorts of false information. So we need to really encourage our young people, and I certainly do that every Sunday at our church liturgies, and I encourage all people, especially within our own Lebanese community or our church communities, to be vaccinated. And this is the way, as we've all said, the way looking into the future where we can return to a sense of normality. And if we want to do that, then we need to get vaccinated. And I really want to encourage that. And I have been, and I will continue to do so to the best of my ability and our community's ability and our networking services. So I thank everybody for their words and for their encouragement and for the work that has gone into the preparations and the availability of the vaccines. We're certainly blessed and we're very lucky. We have everything at our disposal. Even if we stay at home, we are still more blessed than many people around the world where we have everything available to us. So I think I shouldn't take this for granted, but we should work for a better future and a brighter future. And the only way to do that is everybody to be vaccinated and to work together, to care for one another and to respect one another today and always. I thank you very much.
Thank you very much, Monsignor Joseph Takji, OAM. Minister Spencer, I understand you have another commitment to do, and so thank you very much for joining us. I'd now like to invite Dr. Ziad Itani, Consul General of Lebanon. Thank you.
Good evening, everyone. Thank you, Vivian, for arranging this forum tonight. Good evening to all the officials from the Victoria government and the Honorable Steve Braggs, all the MPs. It's a pleasure to be with you tonight. What we are discussing today, it's about a thing very important. It's about the health of a human being. It's not about business, about money. The health is most important for comparing to any other thing. As a consulate, we are trying to help all the people to get vaccinated. And according to the data we have, we launched a campaign last week and sent more than 2,000 emails calling all the Lebanese community to cooperate and to get vaccinated. This call was for the Lebanese community and those all of Lebanese origin and all friends who have been and continue to be role models and examples towards the rest of the state's communities and leaders in enforcing the law in the state, to take the highest degree of prevention and abide by the health instructions issued by the competent authorities in the state to reach high immunity among the community. These instructions are for your own good and for the preservation of the lives of those you love. It's the responsibility of the head of the household towards his children and his family. So get vaccinated, get vaccinated. We are lucky to be in Australia this year, and also we were very lucky to be in Australia last year. As we won the war last year on this virus, I think we can make it this year. Myself, me and the family, we took the 2 jabs for the vaccination and everything were good and we are in good health. We are ready to help in any translation for any brochures from the Victorian Multicultural Commission. If you want to translate any brochure for the Arabic and to send it according to our data to the Lebanese community, we are ready to do it. Again, my call to all the Lebanese community, please be leaders in your society and the Victoria community, as we know you always. Get vaccinated and we are always will be there to help. Thank you so much.
Thank you very much, Consul General. We have Professor Dr. Afif Haj and Dr. Sehem Mustafa. Over to you. So we have Professor Dr. Afif Haj.
Dr. Afif, you want to start or you let me start first? can't hear me. I think Dr. Afif is mute. Yes, to.
I've unmuted myself.
You mute yourself. Okay, you want me to start?
That's it. You go and I'll follow you.
Okay, just to know the time, very short time. Really, I'm a GB, and I think GB is the first contact point for anyone with health concern. So we have got a good role in this deadly virus. So first, what I want to tell the people, we know the symptoms of COVID virus, that it has got fever, bad cough, with sore throat, loss of taste, loss of smell. This is what we used to know about COVID virus. But the Delta modification now doesn't have these symptoms. It appears as headache, sore throat, fever, of course, and runny nose. So some people are underestimate these symptoms, and really early detection and early diagnosis is very essential for the course of the disease to be fatal or to be bad or to go easily with easy recovery. So I would like to point to the people that runny nose and sore throat can be mixed with a high fever. Many people with high fever, they would ignore these symptoms. But really with high fever, we never had fever. So if you have got a fever and these symptoms, this is make a red flag. The other thing, the other symptoms can be mixed with common cold and flu. And we have to take it seriously. The way you can address that, you have got two ways. Either go for PCR straight away, or you can ring your doctor. Now we have got the telehealth, so the doctors are much more available over the phone than it used to be. So early detection, I found it as this is very important for the progress of the disease. The second thing, how to prevent this disease. All the precautions, the mask, distance, all these sorts of things has to be followed. But the most important one is vaccination. And I can hear from people, maybe as a GP, you hear a lot from people, you have to go for vaccination. No, we don't. Some would say that vaccination would affect our DNA, which is not right. I explained the virus is RNA and not DNA, and never go to the nucleus and affect the DNA of the virus. Some, with all these gossips that there is tracker or microchip to follow us, they have got a lot of false stories to prevent people from vaccination. At the beginning, we had some scientists and even some doctors were opposing the vaccination because there was no thorough testing and determination of the safety of the vaccination at the beginning. They were in a rush because we have to face this deadly virus as soon as possible. Even if they have got this point at the beginning, now after vaccination of millions and millions and millions of people, I think the vaccination has proved its safety. So we have got all the statistics and data to prove that. Yes, there are some severe reactions which happened. It wasn't addressed very well at the beginning, but now we are aware of it. There are, see the time, mistake. They say there could be severe reaction as anaphylaxis. And this can be dealt with good history from the patient, but you can't predict, it could happen. But in every center for vaccination, they are prepared for that. They can deal with any anaphylactic reactions. The other thing is the thrombosis. It's thrombotic but cytopenic thrombosis, which is caused by AstraZeneca and starts in 3 to 40 days. This is very rare, but it also can be cured once you have got symptoms. If you have got headache, if you have got abdominal pain, if you don't feel, you feel sick and not well, you just seek medical attention. Always early medical attention is the clue and the key to have better results. Also, there are some, I would say first, there is reaction after each vaccination. It could be sore arm, a bit of fever, fatigue, a bit of headache, sometimes joint pain, these sort of mild things which disappear in 3-4 days at a maximum, maybe 1 or 2 days. But the severe reaction, one is the thrombosis for AstraZeneca. Also for Moderna and Pfizer, there might be all these mild symptoms, but the severe one is myocarditis and pericarditis. Myocarditis is inflammation of the muscle of the heart. Pericarditis is inflammation of the covering of the heart, the membrane around the heart, the pericardium. If you feel after the vaccination with chest pain, palpitation, shortness of breath, you just seek medical attention straight away. So I really promote the vaccination. It is safe, it's efficient, it's over 90% protection. We can get it from the vaccination. And these bad reactions are very, very rare. And I want to say, with all the vaccination we know, and we go and take it, there are certain very bad reactions could happen, but it's very rare. So it's nearly the same. But now, because we are immunizing millions and millions of people, so this number shows up. And because the people are curious to know the safety, so they are concentrating in this matter. But in any vaccination, we could have this severe reaction. The other thing, vaccination is not just to protecting yourself. You have got the right to protect yourself. You have got the right even to go and commit suicide. It's your life. But if you are not vaccinating, you are jeopardizing the people you love, your family, your friends, your contact, the public at all, as a whole. So you are really responsible to have the vaccination. It's an obligation for the safety of the people around you. You have to have the vaccination. All this is beside the obligation for your health also to be safe. I think I used my time. Okay, Dr. Afif. Hello.
Thank you very much, Saham, and good evening, everyone. Thank you for asking me to speak at this forum. I thank the Australian, New Zealand, Lebanese Chamber of Commerce and Industry and its president, my very good friend Fadi Zuki, for initiating this meeting. I personally know most of the participants in this forum. For those I do not know, by way of introducing myself, I graduated from the University of Melbourne Medical School 50 years ago this year. I was the first Lebanese-born medical graduate in Melbourne. I became a surgeon. I practiced in Melbourne, and because of my Lebanese background and the fact that I speak Arabic, I have treated in my 40-odd years of medicine thousands of Lebanese from all over Melbourne and Victoria. In fact, I had people come and see me from interstate because of my Lebanese background. I can truly say that I know the Lebanese community, not just through medicine, but also through my involvement in the community affairs. Now, we're speaking tonight because the majority of Australians, and Lebanese included, are going to be vaccinated. We know that. We're nearly at 70%. I think today we're at 62% who've had the first jab, and we're about 38% here in Victoria who have had the 2 jabs. But there is a significant minority within the Lebanese community that are hesitant and resistant. And this is why Fadi and I and the Chamber of Commerce and Industry started talking about this. What I want to say is that the Lebanese Victorians or the Lebanese New South Welshmen are no different to any other group in our Australian community. Let me tell you, the Lebanese are smart, intelligent, intuitive. However, sadly, like a significant minority in our community, they receive their news and information from the internet and social media, where many charlatans masquerade as experts on medical issues, spreading dangerous misinformation. Give you an example. I recently had a very intelligent businessman ring me to tell me that a doctor in Lebanon had posted a video that showed a magnet that had been placed over a vaccine injection site. The video showed the injection site elevate, indicating that what in fact was supposed to be the vaccine was a metal object that was administered. This is not, this telephone call did not come from an uneducated, ill-informed person. It came from a very intelligent person who runs a significant business. There is so much misinformation out there, and I'm going to say that not all of it is from the internet, because at times...
Hello?
Yes?
So please go ahead.
Because at times we have had people in authority who should know better, who have said things that should not have been said. I want to say that from my 40 years of dealing with people, not just Lebanese and others, you need to explain in lay terminology the benefits of a public health measure, and you will have people come on side. What the Lebanese community needs to hear is the message from people they trust. They need to hear messages from people whose opinion they trust. And they need to hear it from doctors. I want to emphasize this again, because I think sometimes people do not appreciate the role that doctors play in this. They need to hear from doctors that they trust and respect, doctors who are known to them, who would explain the benefits of this public health measure, as Dr. Siham said, to them individually, to their families, and to the rest of the community. And let me state the obvious. That explanation has to be in Arabic. As we're near the 70% milestone in Victoria, and we will get that, I do not want to see my community, the community that I've served for over 40 years, be left behind. Because once we get to 70 and 80% vaccination, which we will get, the one thing I do not want to see is that 20% that are not vaccinated are overrepresented by the Lebanese community, because we did not pass the appropriate message to them. We have not counted the garbage that is on the internet, on social media, and this misinformation that is being peddled out there. Now, Mr. Brax, in the Kane government years, the Ministry for Ethnic Affairs recognized that there was a huge unemployment problem within the Lebanese community. And they set up, at the time it used to be called the Ministry for Ethnic Affairs. Peter Spiker was the minister, with your friend Dimitri Dolis as his chief advisor. We set up a Lebanese unemployment project that looked into this particular problem. And if there is something that I hope we will get out of this meeting tonight, is that a Lebanese COVID vaccination project is established under the auspices of the VMC, but is led by respected and trusted Lebanese professionals who would work with. Now, let me say, the Lebanese are generally a people of faith. The religious leaders are incredibly important in passing this message on to the Lebanese, but standing next to Monsignor and Sheikh has to be a professional, a medical professional who is known and respected by the community, who will pass on the appropriate information. Thank you for listening.
Thank you, Professor Doctor, for your 40 years of advice. Much appreciated. We'll now go to Dr. Michael Corella for a few words, and then we'll have Professor Benjamin Cowie from the Department of Health, who will have with Professor Cowie a number of senior departmental executives on call to be able to answer any questions that we may have. I'll go to you, Dr. Michael Corella. Thank you.
Thanks, Viv, and thanks, Ferdy, and everyone who participated in this forum today. Just to give you a very brief, we are as a Victorian Lebanese Community Council from the day one, when the virus started in Australia, we've been very active. And just to let you know that our Facebook was #1 information to all the Lebanese and Arabic community in Victoria. And I totally agree with Dr. Haj. Before this forum, we advertise this forum on Facebook, and we get so many questions, to be asked today from the community and people they wanted to hear from professionals, from medical doctors, especially our GPs. They want to hear from them. They said to us, we don't want to hear from religious leader or politician. We want to hear from someone professional who can answer all our questions. We have so many questions. And some of the questions they're saying, a lot of our young people, which has already been mentioned here, they think, even if they got the corona, it won't have big impact on them. So that's why they don't really care much about taking the vaccine. The second one, a lot of people asking, I'm pregnant woman, do I have to take the vaccine? Some people, they say, I've got an asthma, I've got a blood pressure. There's so many questions in the community. And unfortunately, because we come from a country where we don't trust authority, so it takes longer for everyone, to trust authority even here. So that's why it's very important to get the message out. As Dr. Afif said, we need to get it in Arabic. We've been very quick translating all this update from the Department of Health, because a lot of our community, they don't go to the website, to check information. They rely on someone, on community organization, to translate it and send it to them. So we've been sending out to every member of our community to get the message out. So a lot of questions, I really want the health professional to answer it. Some people are asking why we don't have choice. Why do we have to take the AstraZeneca after all what's happening? Once it's been for over 50, then over 60, and now everyone can take it. So there was a lot of confusion, not just in our community, in the mainstream community. So we need really our health professional, especially our GP, to be educated to the community, to trust them, and to give them the right advice and answer all these questions. And that's how we can reach out to the community. Unfortunately, now in the northern and western suburbs, where there's big population of the Lebanese community, a lot of shops being shut down. We haven't been able to get the message out to everyone, to make sure that they don't visit those shops. Family connection within the Lebanese community is very important. Sometimes it's very difficult to convince them not to visit each other. We're getting calls from normal people. They're saying, oh, look, in Olsen Place, in Broadmeadows, people infected with the virus, and people, congregating together there. So where is the authority? So we're getting questions from everywhere. Some people are very concerned about the virus, the spread of the virus. The other part of the community, they're concerned about the question. And as Dr. Haj said, a lot of video now coming from, if it's from Lebanon, a lot of people now watching the satellite from Lebanon, a lot of channels, many channels from Lebanon, a lot of doctors, they give different different and contradictive information about the virus. Some question also about, what's happening in Israel now. They were the first country, they've been vaccinated, and now they have to take the booster. That's mean how long the vaccine will last? Is that 2 months or 6 months? Do we have to vaccinate again? How effective the vaccine? How the vaccine will affect our DNA? So there is so many questions within the community, and probably we need health professionals to answer all these questions. This forum is great today, but again, I think we need to follow up with our health professionals to get the message out to the community. And thank you very much.
Thank you, Dr. Marco Corella. We now have health professional, Professor Ben Cowie, Acting Chief Health Officer from the Department of Health, to give us an update. Along with Professor Benjamin Cowie, we have Dr. Tom Shoes and Dr. Mohammed Mohadeen from the Department of Health vaccine team, Dr. Michelle Dallaire for any QR code related matters, Maren Bammett from the Department of Families, Fairness and Housing on any support needed for testing and isolation, and also Mia Bromley in relation to any cases, contacts and contact tracing and outbreak management. All these senior departmental executives are on the call tonight to answer any questions we may have, including the questions in the chat function. Over to you, Professor Benjamin Cowie.
Thank you so much, Viv. And I'd like to start by acknowledging the traditional owners of the lands where I am currently, the Bunurong people of the Kulin Nation, and their elders past, present and emerging. I'd also like to acknowledge the role of the VMC and yourself, Viv, in bringing together all of us here tonight, and your ongoing efforts on behalf of the multicultural communities that make Victoria such a wonderful place to live. I acknowledge Minister Spence and her parliamentary colleagues, and the Honourable Steve Bracks, and especially can I acknowledge the community, faith and medical leaders of the Lebanese community who we've just heard from, and others who are here speaking tonight. And I'll come back to reflect on the central role of those leaders in the response, not just in the Lebanese community, but indeed in the Victorian community. So in the past 24 hours to midnight last night, there were 221 new cases of COVID-19 diagnosed in Victoria. So that's 220 people who did the right thing. They got tested when they had symptoms, and that allows us to give them the care they need. But it also means that they are then protecting their families and protecting their community by isolating and preventing onward-going transmission. So my thoughts are with them. They're in a very stressful part of their lives right now. Many of them will be feeling ill, and our health system stands by to look after them. But thanks to those people for doing the right thing. We now have just under 2,000 active cases, so that's people living with COVID-19 in Victoria right now. And our thoughts are with our friends, our families and our colleagues in New South Wales, where there's 27,000 people currently actively infected with COVID-19. And we are seeing record numbers of vaccinations being given in Victoria. Yesterday, there were nearly 37,000 doses of vaccine given, which is a record number of vaccinations for a single day in the state system alone. That's not even including the fantastic work being done by Victoria's GPs and pharmacists who are actually giving more doses than the state system on a daily basis. So I'd like to thank everyone who's responsible for all of those responses, and to everybody in the community who are doing the right thing. The hard thing, which is to isolate, is to have those tests when we have symptoms and not visiting friends and family at this point in time. We all want to do that. We all miss our extended families, our friends, our loved ones. But the worst thing we can do right now is to actually be in touch with them in this setting of the pandemic, because the last thing any of us wants to live with is the knowledge that we have put our loved ones at risk and that we've introduced infection into a household that we care for. It could not be more important that we avoid that at this point in time. The way out, as we've heard from so many of the previous speakers, is vaccination. Vaccination is the thing that will squash this pandemic, and we must all work to ensure that every Victorian has the information they need, the trusted, authoritative information delivered by people they trust. And picking up on the conversations before by some of my general practitioner colleagues who are just speaking, they are perfectly placed to give the information to the community that in a trusted way and in a way that's respectful of culture, faith and language. And I hope that some of those GPs will volunteer to become some of our clinical champions for the vaccination program and work with our vaccine program to get those messages out and to use their expertise to support their community in another way beyond all the fantastic efforts they're already doing. Wearing masks makes a huge difference, including outside. With the Delta variant, we are seeing increased transmission of COVID-19 outside, and it is so important to wear a mask. It is so important to use the QR codes. They give us advance warning. They allow us to connect people to the public health response well before the case interviews and everything are able to draw that information out. So please, for your safety and that of your family, use the QR codes when you are going to anywhere. There are financial and food supports available for people who are doing the right thing and protecting the community by isolating if they have been exposed to a case of COVID-19. So that is available from our colleagues in government. So we also all need to work together to look after those who need it most, to need our efforts and our protection most. So we need to do all of these things for our parents, our brothers, our sisters, and our friends. And it's so we can get back to seeing them again and reconnect with our families in a way that we all crave to. Several of the speakers have spoken about young people, young, healthy, strong people feeling that if they get COVID, they're going to be okay. And many of them will be, it's true. But some of them get very sick. I myself, and I know my colleague Tom, who's here tonight, have looked after young people in hospital with COVID-19 in the last year. People in their 20s, people in their 30s who got very sick. We've got teenagers in intensive care in Victoria through this outbreak. So it does get young, healthy people as well and makes them sick. But even more importantly, young, healthy people can protect the less healthy, the older, people with medical conditions. And they've got such a strong role for protecting their community. So we've got 120 people in Victorian hospitals with COVID-19 tonight, right now. 33 of those people are in intensive care. And tragically, some of those people won't be coming home to their families. They will lose their lives despite our best efforts of our health system to deliver the care they need. And that is a profound tragedy, and that is going to get worse. We are seeing increasing numbers of people admitted to hospital. There will be hundreds of people in hospital in short order. In New South Wales tonight, there's 1,200 people in hospital with COVID, 200 of whom are in intensive care. This is what we are seeking to protect against by vaccinating as many people as we can and by all of us following those rules that we wish we didn't have to, but they're our way of protecting the community. Finally, with vaccination, we know that vaccination helps protect you from getting COVID-19. It also means if you get COVID-19 in the early days after your vaccination, you actually are much less likely to infect people around you. So your vaccination, even if you get COVID, protects your loved ones and your family. But especially whether it's AstraZeneca or Pfizer, they both result in a 90% reduction in serious illness and going to hospital. These vaccines protect your health and they will protect our health system so we can look after those most vulnerable. At the moment, of the people I mentioned, 120 people in hospital, as far as I'm advised, not one of those people is fully vaccinated against COVID-19. These vaccines work and we need to make sure all of our community members get them as soon as they're eligible. Now, in terms of getting access to vaccination, the pop-up site that's been established at the Australian Islamic Centre in Newport, I believe it vaccinated. Can I offer the profound thanks of the Department of Health and all of my colleagues to everyone involved in that pop-up site, especially the Australian Islamic Centre, showing that practical, fundamental leadership and support for the community. And we're hearing fantastic things about that site. So thank you so much. We are working as the department through plans for other pop-up sites, again in partnership with trusted community institutions, and there'll be more information on that coming out soon. There are other vaccination sites in the western and northern suburbs, including drive-through sites at the old Melton Bunnings, at the Eagle Stadium in Werribee, and the old Ford factory in Campbellfield. And there's a range of Vic sites, all of which can be booked into using our hotline or on our website. But that's not to forget our fantastic GPs, such as the ones we've just heard from, who are delivering so much vaccination for the community, including pharmacists and community. So finally, and I'll finish now, Viv, because I know we're short on time, is the most trusted sources of information for their community. Our healthcare workers, whether that's in general practice, pharmacy, or in our hospital system, you are the most important elements in the response to COVID-19 for our community. So we're here to listen to you and to learn from you, and together to work to support the health and well-being of all members of the Lebanese community in Victoria, and through them, the entire Victorian community. Thank you, and back to you, Viv.
Thank you, Professor Cowie, for that plea and that presentation. There are lots of questions in the chat function, and I trust that the Department of Health are responding to them, including some of those from the Facebook page as well. So whilst we are attending to the questions in the chat function, if you have more questions, you could use the raise hand, and I can see Celine has raised your hand. So I'll go over to you first, Celine.
Hello, so my name is Celine tonight in the capacity of the Australian New Zealand Lebanon Chamber of Commerce Young Entrepreneurs, which is the first youth arm of any Middle Eastern Chamber of Commerce and Industry in the world. And we also amalgamate the Monash, Latrobe and Lebanese student societies. From a youth perspective, there are two main things that I would query. The first, perhaps most significantly, young people feel like they're not being given a choice. And I feel like this is a big reason why there is a resistance, especially amongst youth, with regards to vaccination. They feel like the choice is being taken away from them. And I feel like a big reason why a lot of people are saying no, especially younger people, is it's their way of fighting back, of saying, no, I have a voice, this is my body and I have a say. And I think something that we all need to do, and perhaps, you know, the government, the department, whatever it is go about this narrative in a way that doesn't feel forceful, but it's more of a choice. Because right now it's feeling like if you don't do this, you're not going to be able to do that. And I feel like that might be a lot of the reason why there's a resistance. More so, a lot of conversations I've been having with young women within our community, my friends, my colleagues, has been to do with fertility. As a young woman myself, who's just recently been married, I want to have children. And there is a lot of questions about if we get vaccinated, and a lot of conspiracy theories that we've heard about if we get vaccinated, are we going to have fertility issues? Is it going to render us infertile? Are we going to have issues with our menstrual cycles? And within our Lebanese community, a woman being able to conceive and bear children is of significance. So I guess my question is, what would you say to those women specifically out there, and perhaps even men, who have these issues about fertility, menstrual cycles, and perhaps becoming sterile as a result of vaccination?
Professor Cowie.
Thanks, Viv. So the second part of that question, I'll probably hand over to my colleague Tom Schultz, who can address some of the particular fertility issues you've raised, because they're really important ones. I acknowledge that. I might take the first part of your question, Celine, if that's okay, which is about the sense of being forced, not having choice, the idea of mandating vaccination. So these are really important discussions to have, and it would be really great if we could continue this conversation with you, both from a youth-focused perspective, but obviously youth from the Lebanese community, in very short time, because I know that Viv will start getting angry with me if I don't finish quickly. So there is a choice. There is no mandatory vaccination for anybody. There are some occupations where to do that occupation, such as in aged care, people will be required to have the vaccine to continue to work in that area because of the need to protect those very vulnerable individuals that are being cared for. But I take your point. If we're approaching a point where we're saying you're going to need to be vaccinated if you're going to go to this hospitality venue, or you're going to need to be vaccinated if you're going to travel, that can easily be perceived as forcing people's choice. I guess the flip side to that is we, from a public health perspective, need to be able to say, well, if you're fully vaccinated, your risk has dropped so significantly that some of the controls we need to apply to keep COVID under control, we no longer need to apply to you. So in another way, it's actually reflecting that individual's choice to get vaccinated means there's significantly less risk to them and the community. And so as a consequence, we're stopping forcing them to undergo some of those restrictions that otherwise we need to have in place. So it's a subtle point, and I think it's one that we need to communicate a lot better, and it'd be great to work with you on how to do that.
Absolutely, I want the opportunity.
Tom.
Yes, thank you, Celine. And look, I think you touched on something which is, in so many ways, your community holds the keys to connecting with your community. And that sense of someone else telling you what to do is very different if it's your own community, through whatever means you've got, saying to you, actually, this is a really good idea. And as Ben mentioned, possibly there's some rewards or some incentives to encourage that. So we strongly encourage yourself and all your community, because there's a whole lot of nonsense out there. We know that. And the fertility, it's one of those bits of nonsense. And it's really got to run on the internet in all sorts of ways. We know from studies now that it doesn't affect male or female fertility over periods of time, and that there's not a concern. There can occasionally be some slight alterations in women's menstrual bleeding and so forth, very occasional, but not impacts on fertility as such. And that's the sort of message that we almost need to do our absolute best to counter those things that are out there on social media and have just sort of blossomed and really can create a whole lot of problems throughout the community. So strongly, thanks for your support, and to the whole community's support, because people, sort of doctors from the department, often we might push back against them, but people have much more respect for the people from their own community.
Thank you, Celine, and thank you, Tom, for the question and response. I'll go to Naeem Malam and then to Anthony. Hello, Naeem.
Thank you, Vivian, and thanks to all our speakers. Perhaps the questions I wanted to ask, we're trying to promote the vaccination so much through the community leaders and all the good work it's happening. I'm good and supportive of it, and I'm doing everything I can. But I think there is a lack of communications between the government and the whole community in general. We get, after I turn 50, every 5 years or 3 years, I get sent a kit about the bowel cancer, and they encourage me to go and do a test. And now we've got a virus and we have vaccine, and encouraging people to go and vaccinate. But we have people sitting at home, elderly people, nobody contacted them, nobody approaching them, and they sitting home and they saying, no one contacting us. So what I really think, we need more than just the community leader encouragement. I think now we're at stage where the government should be able to identify how many of our population is being vaccinated, who hasn't been vaccinated yet, target group of people, whether they're young people or elderly people. I think the time is coming up. I don't want to go more than that, but I think my questions is clear, and I hope Professor Cowie.
I can answer that briefly. Again, thank you so much for that input. I do note that the Commonwealth Government has written to some of the people who are aged 60 and over who have not yet been vaccinated have written to them to encourage them to do so. But I think the broader sweep of your question is, how do we identify individuals who have not yet come forward, and how do we support them to be vaccinated? And I think one of the key elements of your question is around using the data we have, looking at things like uptake by area, uptake by country of birth or language spoken, so that we can target those invitations to be vaccinated as best as we can. And I think more work does need to be done there. I totally agree with you.
Thank you. I'll go to Anthony and then to Rana. Anthony. Could you unmute, Anthony? Please unmute. Thank you.
Fine. I think thanks for all the speakers and the organizers of this forum tonight. It's very useful, especially to the Australian Lebanese Chamber of Commerce and all the professionals on the panels. My question is, lots of people from our community, and I live in a municipality more than 45% born overseas, and we are having very high-aged community or individuals. They don't have the resources to follow the government advice and so on. And I believe personally and strongly believe the services face-to-face is disappearing. And I know for the environment we live now, we cannot have a home visit or encourage people to attend forums and ask direct questions like face-to-face. And this is also the not enough advertising within the Lebanese media for such disease, the COVID-19, and how affect not only individual but the people around you. If there is any way to pass the message to mainly the community centers, a group, individuals, and move the jab injection from one area to another by encouraging people to attend and through the community leaders or the media. This is something I do believe. Plus, the social media have a very negative input to people who follow it, you know, Facebook or YouTube, and lots of people believe in it. So I don't know what the answer to that, but I think some of you answered the question. So what we are now in a very difficult times, and what the solution? I'd like to hear from you.
Professor Cowie.
Thank you. Such valuable input and deep thinking behind that. And I always learn so much when I come to these sorts of fora, and that it always makes me think so deeply afterwards. So thank you. Look, you're absolutely right. The communications need to be both tailored to the community and respectful of community, but also need to be backed up by, you were talking about sort of media, particularly in the media, and how that can be leveraged. I know that there's been some work with community broadcasting, for instance, and Viv has been involved, and the VMC have been involved in that previously. But I think, you know, your points about ensuring that the broader messages are appropriately reflected in priority communities, and you know, obviously the Lebanese community is a high priority for us. We would take your advice. We would take your guidance on how best to do that. But it's a critical point, and thank you for making it.
Thank you.
Thank you. I'll go to Rana, then to Bernadette. Rana.
Hello, and thank you so much for the insightful meeting today. Well, actually, I do have an idea, if possible, to share with you, and a question. The idea is to be able to, to spread the message by storytelling. It's very important for the society to have a customized message. It's not only an invitation to take a vaccine because it's it's something helpful and it's something good for the family, etc., etc. Sometimes customizing these kind of messages to people, for those compassionate people who can really be taken with a compassionate story. I think there are too many successful stories that can be spread into the audiences and everybody else, instead of hearing all those misleading messages from others. At least there will be a balance in between those storytelling and those bad messages that been spreaded so quickly, and thanks to, of course, to social media and other channels. This is one. Secondly, my question is, when I took my first dose of my vaccination, the pharmacist where I took my vaccination asked me if I want to go for 4 weeks or more than 4 weeks. For me, as a person who wanted to be fully vaccinated and officially healthy and ready to get to life again, I said 4 weeks. But now, what's the difference? Because later on, people start asking me, no, Rana, you should have taken 6 weeks or 8 weeks. And to tell you the truth, I don't know. I very much feel ignorant when it comes to the duration and who chooses the duration. It's us who are getting vaccinated, or the people, the medical people like the pharmacist who gave me the vaccination should advise me whether it's 4 weeks or more. Thank you.
Ben?
Yeah, so I'll start with the first bit, and then again, maybe Tom can talk about the intervals and the appropriate intervals there. But just to reassure you, Rana, like as long as it's 4 weeks and above, it's still fully vaccinated and you're still a full Victorian. So you can be short on that count, but Tom can discuss the differences in the intervals. Your point about personal narratives and stories are from people, whether that's about having COVID, whether that's about getting vaccinated, I think are incredibly powerful and cut through in a way that rattling off how many cases there were or how many people in hospital or what percentage protection it gives you will never cut through in the same way. My challenge then would be, it is very hard for the government to identify people who are willing to share their personal narratives in a public way. It is a lot more appropriate, I would suggest, for members of the community and community leaders to discuss that possibility with, people who have been vaccinated, people who have experienced COVID and others. We would be extremely happy to support those being produced and put on social media to be shared more generally in any way. But I think we don't have connections with community in the same way you do. So if that was something that I could put back to the community leaders here tonight, if you've got personal stories about vaccination or about experience with COVID that will help the community to get those messages in that really trusted way, we would be extremely happy to work with you to produce those and get them out as quickly as possible.
Thank you. I'd like to thank you, Ben, for this. Even if you can't get stories from real vaccinated people or COVID patients or anything, sometimes even filmmaking or coming up with a scenario, maybe something to actually to give this compassionate feeling to people, because the uncertainty is absolutely a killing feeling, and I'm sure that whether people are educated or not, we're all going through this. So thank you for your point. I'll wait for Tom to reply.
Oh, thank you. Just about the interval. So 2 questions. With the Pfizer, initially we had it as a 3-week interval, but in order for more Victorians to get at least 1 dose first, because there was a limited short supply of Pfizer, we stretched that out to 6 weeks. So at the moment, the interval recommended for Pfizer is 6 weeks. And In the UK, they've used 12 weeks. In the US, they've used 3 weeks. In the trials, they've used 3 weeks. It's all been very effective for Pfizer with any of those intervals. With Astra, they've used between 4 and 12 weeks in different situations, and they've all of that range of intervals has been very effective. Now,
who judged the 4? Like for me, when she asked me, the pharmacist, I said 4 weeks. So is it my choice, or it's a medical choice to confirm whether that 4 or 12 week as an AstraZeneca, for example, dose?
yeah, the current recommendation in Victoria is 6 weeks for Astra, but 4 weeks is absolutely fine. It's a bit of a balance between, we've got these targets now, 70, 80%, and wanting all of Victorian to get to those levels. So bringing down that interval to the second dose helps us get there a bit quicker and gets more people doubly vaccinated sooner. So it's a balance between how long we wait for the second dose and bringing it forward. But be reassured that particularly against preventing you getting severely sick and ending up in hospital, whether it's 4 weeks or 12 weeks for Astra, it works really well.
Thank you. I'm very conscious we're at 8:30 and we still have 3 more questions. So I wonder if it is okay just for us to take 1 more question. Okay, I take silence as in agreement. So Bernadette and Tarek, I really hope you don't mind if I go to Monsignor Joe Tadke for your question. Monsignor.
Sorry, I want to make a statement and just an encouragement. I know one of Mr. Cowie spoke about people in intensive care. One of the young men from our community is in intensive care at the moment, and it's not looking too good. What's happened? He wasn't vaccinated. A lot of his friends weren't vaccinated. Now all his friends and the family and everybody speak about getting vaccinated as soon as they can. So unfortunately, people are waiting to that very last desperate time to get vaccinated and or to be even to consider whether they are going to be vaccinated with their families. And it's sort of a crucial time within our community where the information needs to be out there, very, very quickly. What we've spoken about tonight has been really wonderful. I know there's lots of ideas going around, but I know that also I just want to promote next Wednesday night, the Australian Lebanese Medical Association having a question and answer night in Arabic and in English for members of our Lebanese community with Dr. Samar Ujjaini, who's an infectious diseases specialist. So I really want to encourage people to share positive information and to share all this information very, very quickly within our own community. We don't want to wait till somebody's in intensive care, then we say, oh, look, I better go and get vaccinated. And that's, I think, what we're all saying tonight. I think it's really wonderful what we're saying, but we want to get to the others who are not vaccinated at this stage. And I think this is the time, and we have to really advocate for positive information and share this information with every member of our community. And I thank you all for your wonderful advice and support. Thank you.
Thank you, Monsignor. I hope Tarek and Bernadette, if you don't mind putting your question in the chat function, and we'll try and provide with all of the responses for those outstanding questions as well here at this meeting and also on Facebook. Before we formally close, I'd like to invite back the Honourable Steve Rex to have your final words.
Well, thank you, Viv. And look, it's been an excellent forum, and congratulations to the Chamber, really, and others who have organised this. Congratulations to the Victorian Multicultural Commission. We've had some really good feedback, and I think you've heard this, saying that we need some testimonials, we need some storytelling, we need some examples of people who've been through COVID and then describing what that was about and advocating, therefore, for prevention, which vaccinations will give you. We've heard how successful the pop-up clinics are. The Newport Islamic Centre as an example, and more of those. That's really taking vaccinations out to the community, and you can advocate really by doing that. And I think we've heard that that's really one of the areas that we'd like to see happening as well. And we've also we also should point to the joint statement which the leaders of the Lebanese community have called on, the call to action. We should spread that out as widely as possible. It's signed by a large number of people from, you know, my former profession of politicians to medical experts, to religious leaders, and make sure we get that out and make sure we get that advocacy out more broadly. And also, as we've heard, there is other forums and other events which are coming up. Make sure we get involved in those as well, because they're going to be important in getting the message out that it's important that we achieve our targets in vaccination. It's our only way out of this pandemic, our only way out to be united with our families again, to be able to travel, to be able to get back to something of what we had before COVID as well. So thank you very much for everyone being involved. It's been a great session, and hopefully out of this we'll have some further lessons going forward of how we can get this message out more broadly. Thanks very much.
Thank you, the Honourable Steve Rex. And we've taken lots of notes, and the recording tonight's for that purpose. And Fadi and Mustafa and I will have a debrief after this meeting to gather all of the thoughts, suggestions, and so on and so forth, so we can have an action plan as well from tonight's conversation. Thank you to all of our speakers, ministers, former premier, faith leaders, business leaders, and each and every one of you for joining tonight. And a special thanks to all of the executives from the Department of Health, the Department of Families, Fairness and Housing, the Department of Jobs, Precincts and Regions, the Department, the Victorian Multicultural Commission, and everybody for bringing this event together for all of us. Thank you and have a great evening.
Thank you.
Thank you. Thank you. Thank you, everyone. Bye.
Thank you very much.
Explain whether COVID-19 is a scam or
someone's got a message there for us.
That's right, Rosanna. There's been a bit of that in some forums, and so it has happened.